Hello, welcome to Nurse Practitioners Changing Practice. I'm Dr. Carol Berger.
Hi, I'm Dr. Nina Zimmerman.
And today we are joined by Dr. Rodriguez. Well, thank you so much, Carla, for being with us tonight.
Yes, thank you for having me. I'm really excited. Thank you.
So, Dr. Rodriguez, you practice at the Friend Family Health Center in Chicago, and you've been there for 5 years. So, tell us a little bit about your practice.
So it is a family practice clinic. We provide internal medicine, OB-GYN, and pediatric services to our patients. We have 7 centers across the south side of Chicago, and we service patients of all ages. The predominant populations that we service are African American and Latino communities in the south side of Chicago. So that is globally a majority of the patients that we service, and they also are all in underserved communities, patients of lower socioeconomic status. The clinics are considered federally qualified health centers, and majority of the patients that we have are Medicaid patients, so they receive Medicaid insurance, and that's their primary payer as far as insurance. And we do have a number of patients who are uninsured. So, those contribute to some of the, as far as the patient population, the majority of the patients that we service.
That sounds like a pretty nice array of patients. So what have you liked about being there?
Honestly, I believe one of the biggest things that have kept me at Front Health is just my passion for community health, honestly, and just serving patients with greater challenges, honestly, with as far as healthcare, access to healthcare, having a medical home, their need for services, in challenging areas and populations where there are fewer services and there's a greater healthcare need, higher complexity of care. It's a lot of social determinants as well as healthcare determinants. And that just kind of drew me to community health in these neighborhoods and areas. And it's really been my passion just to service patients that are really just underserved and need a lot more help. And I feel like I just make more of an impact in neighborhoods where I'm needed, honestly. It was always something that I thought about when I was in school as a nurse practitioner. I didn't want to work in the ritzy neighborhoods where, the patients are affluent and they didn't really need me. I wanted to go somewhere where I was truly needed. And that's what kind of fired me up to work in, underserved communities and populations. So that's kind of where I ended up. My entire career as a nurse practitioner has been at community health centers in underserved neighborhoods. Because that's just kind of the goal of my career path, is to service people who truly need it and who are truly underserved, marginalized populations, just people that are in greater need, honestly.
Yeah, I can honestly relate because I practiced 7 years in rural health. And I know, Nina, you practiced.
Yeah, my favorite practice, what I would love to go back to, it financially closed, but was a practice in South St. Louis, but also in a very rural area, and it was my favorite practice. And the patients were just in need. A lot of patients who didn't have insurance or Medicaid, and it was wonderful. Really got to know the patients and had to understand resources. And unfortunately, it just didn't make it financially. And I would have loved to have been, maybe a business partner to make sure it happened that way. It just didn't go. But I commend you. Because that's what we need. We need practitioners. We need nurse practitioners to be caring and serving in areas of great need. And we all have different roles. I'm in a practice in a factory right now, so that's an interesting need for patients too. But just what you're saying really rings true to me as well, is that you want to be in a practice where you really can have good relationships with patients. If you don't have a good relationship with your patient, you may miss something, because if you really get to know that patient, taking care of them is even easier, because they come in and see you, and you can really pick up on some nuances with your history, and your exam and your care because you have a relationship. So
Well, and
that's
that brings us around to a little bit about your study. We're talking about relationships, and I can totally relate because in my practice, that relationship, I actually became part of that family's family. They were almost like
Yes.
family to me in that rural town. And I mean, I got to know everything about every member of the family. So if mom came in with anxiety, well, maybe it's because I knew her child had just gotten diagnosed with a terrible, illness, and I could understand why she would have anxiety, or he, or I mean, you got to know the ins and outs of all the family and what was going on. Maybe they just lost their job, or they, maybe they were making a pot of spaghetti for the entire week because that's all they could afford. So all my
Absolutely.
tips about diabetes, and that leads us into diabetes. I had a patient one time who was diabetic, and I wanted to get his hemoglobin A1C just right. We're talking about nutrition, and I come to find out that all he could afford was to make one pot of spaghetti at the beginning of the week, and he ate that all week long. So there was no other options for him. He didn't have enough money to make that diet the way he wanted it. That was how he was living. So tell us a little bit about your developing your relationship, what made you want to study, the study you conducted, and how you found out that relationships were increased.
So I have been at my current practice for 5 years, and I see a lot of families. So I definitely can share in that sentiment of caring for, the mom and the children and the father and the grandfather and the cousins and nieces and nephews. And I see families with extended family members that come and see me. So, it's definitely a lot of stories are intertwined, and it's a lot of those social determinants that impact health, especially at the level of community health, when patients have challenges of, money, and I don't have bus fare to get to the clinic, or I don't have enough money for my copay. And, those are some of the challenges that we see, especially when we see the entire family. So if, a patient's husband recently passed away, well, I can kind of understand why she's hasn't been in the clinic, and so it's you get to see all the different factors that play into healthcare. Working as a registered nurse, oftentimes we're kind of cushioned in the hospital with case managers and social workers and other people that took care of those social challenges. But in community health, you're kind of the global resource, so to speak. And so sometimes you have to deal with those social determinants because they directly impact healthcare outcomes. And so when patients, don't have money for their medications, well, that's why they're not taking them, and so all of those things sort of impact one or the other, and they're sort of intertwined, so to speak.
Or can they
And
afford to provide a cheaper alternative for somebody that, maybe they can't afford the $100, insulin pen. Maybe there's a
right,
cheaper alternative I can find. Um,
exactly,
yeah,
exactly.
you're absolutely right. You don't have that social worker and case manager there. You are that social worker and case manager, and you're right. If they don't have the resources, they're not going to be able to take the medications. But you did something very unique. Tell us about what you decided to do about your diabetic patients.
So, my medical intervention that I implemented in my study was a coaching call intervention. It was basically a scripted tool. It involved 7 questions. So, it was 2 questions about blood glucose, 2 questions about medications, 2 questions about diet, and then 1 question was sort of open ended to see if the patient had any questions for me as the provider. I wanted to create something quick and practical that I can implement at the point of care in practice, a day-to-day workflow, something that was reasonable and quick. That was sort of like a mini interview just to engage the patient and prepare them for the visit. And
So
also I
you
wanted
would
it to, Mhm.
so you called them the night before their visit. That's what your job was?
Correct. Correct. Yes. So I would use this script. I contacted them prior to 24 hours before their visit. So, or the evening before their visit. So it wasn't always exactly 24 hours, but I would contact them prior to the visit and ask them these questions with this tool just to engage them about their diabetes and sort of prepare them for the visit. And a lot of the patients, you know, it was a lot of varied responses, but it was a significant, you know, level of appreciation from the patients, like, oh, thank you for calling me, and I'll be there tomorrow, don't worry. And it was a lot of really positive energy implementing this tool. And it was really exciting, you know, especially when I found out, you know, as far as the statistical, running the tests and looking at the stats and the numbers and seeing that it worked was really exciting. You know, it's the best part. You pour into this. I created this intervention, so it was my own creation, and I used this and engaged my patients, and it really helped with keeping appointments. So missed appointment rates went down, as well as hemoglobin A1Cs went up, or improved, rather, I should say. So diabetes outcomes got better, missed appointments improved. So it just kind of worked from different angles, and I was really excited about it. And it was a very simple tool that I implemented.
So we're saying that just the fact, I mean, because right now I'm kind of engaged in Medicare wellness visits, and we're doing a lot of them by telehealth. So I call them the night before the visit just to make sure they can work the technology. And they find that, you know, if we do that call to kind of prepare them and engage them, we first of all are showing them we are interested in them, you know, as a provider, and building a relationship. And they're so much more prepared the next day. Like I said, we have less people who cancel.
Correct.
And
Absolutely.
I just wonder if we did a study that gave us, I mean, more time to spend with our patients doing
Yeah.
kind of things, how much would it really save in the long run?
Right.
Absolutely. Absolutely. And I think with healthcare shifting to this quality care paradigm where quality over quantity is the goal, I think that that's something that we all need to take into consideration in all practices across the country. Just focused on the quality of care that we're giving, and not focused as much on time and numbers and chugging out, you know, patient visits every 15 minutes, and really dedicating that time to building that rapport and getting to know our patients, and some of the intimate details of what makes them, you know, compliant to their care, and what helps them to come into their visits. And I feel like that's truly, you know, the meat and potatoes of quality care, is really just taking that time to get to know your patient.
Absolutely. Absolutely. I have a half an hour appointment per patient, no matter what, at my clinic at the factory, because it's a benefit of the workers there, and I have the luxury of having half an hour appointments. And I tell you, you know, some of the appointments could have been a 15-minute urgent care visit like I used to do in my practice, a lot of them. But that 30 minutes is so essential, because I really have gotten to know, you know, I only have a panel of probably 300 patients, but I really get to know them. And I only work once a week, but and there's other care in between, and I'm always kind of on call. But um, now I have other patients that have never seen me. They used to come to the physician, but I'm there every week now because my collaborating physician isn't able to be there. And just having that half an hour to really get to know newer patients that haven't seen me, or they only come in for their physical exam once a year that's required by the workplace, is just been tremendous. And they're relaxed because they are able to do it while they're working, so they're not like rushing to get out the door, because they
Hey,
come to the clinic,
they
they
got
get
a half
the time to
hour.
do it.
Yeah.
Yep.
Yeah,
It makes a
absolutely.
difference.
It does make a difference. You know, I currently have a patient panel of well over 1,500 patients. And
Wow.
yes, and, you know, that's kind of the nature of FQHCs and federal health centers. You know, we see such high volumes of patients, and we only have 15 minutes to make a real impact, which kind of influenced my tool. I wanted something quick, something practical, something easy, and something that felt genuine. You know, when I spoke to the patient, they really felt like I was engaging them, and we had a meaningful conversation in less than 5 minutes. And I think for people who work in the heart of that hustle and bustle, you need something that is practical, quick, and that will impact the quality of care that you're providing. And, it was amazing that this tool worked. It was so exciting, just to take 4 or 5 minutes out of your day to engage your patients and prepare them for their visit, and for it to really make a difference. It just shows what we can do with effective time management in even the busiest of clinics. Really just to take the time to engage with your patients. It sort of deepens that rapport that you have with the patient. It helps them to prepare for the visit. It just kind of is multifactorial in the care that you're providing your patient. So, yeah.
Well, and the important part too, you just said, it can't be replaced by a different worker in the healthcare environment, and we're transitioning to quality of care, which to get paid versus quantity of visits, right? So that means we need to partner with our patients. We need to build a rapport. We aren't the dictator that can just say, okay, this is what you need to do, and move on to the next person. We need to figure out what their barriers are, what's keeping them from being able to achieve the goals that would give them better health, right? So that we can partner with them and help them. And, we have to do it. We have to have a little more time to do that. They're going to have to
Absolutely.
start making more than 15 minutes, because you can't do what they want you to do in 15 minutes and have any kind of a meaningful relationship. That 5 minutes that you took, though, was still 5 minutes of your day that wasn't scheduled,
Exactly.
and
Exactly.
we need time to be able to review our labs. I remember going to an NP conference one time that was so wonderful. This NP has independent practice, and he was autonomous. He had the luxury of being able to decide to go to half-hour appointments like Dr. Zimmerman was talking about. And what he found, but he tracked how much money he saved by being able to look
Yeah.
up CT scans or what was duplicated, or looking over.
Really?
He tracked it, and he found out that he actually saved money, as opposed to he made the company more money as opposed to doing every 15-minute visits. Because
Wow.
you think about the cost of a CT scan. Let's say they come in and they need a CT of their head or their abdomen or something because their complaints justify it, but you don't realize they just had one 2 months ago. Well, he would be able to document that and say, I was able to go review this, and that CT scan costs how much money. And what he made the biggest impact on was weight loss.
Really?
He got
Wow.
way on board for weight loss, and that half hour of really being a coach and figuring out where their barriers were made a huge difference. And they actually tallied up the pounds that everybody lost that month, and would put a sign up. But it changed the whole dynamic of the delivery of care by becoming more personal. And I love that that's what your study showed. It really showed that personal touch makes a big difference.
Yes, absolutely. I think that just understanding the patient's needs, especially already having a rapport with these patients and understanding where they are and kind of meeting them where they are, and discussing practical needs like, do you have your medication? Can you bring them to the visit? Are you checking your sugars daily? Do you have a machine to check your sugars? Asking really practical questions that sometimes may be overlooked, but getting those little finite details and incorporating them into the care, really sort of helps to hone in the focus on the most important essential things in a small frame of time. So my organization really had challenges with during the time of this study that I did. There was a lot of challenges with productivity and getting patients in the door. There were high levels of missed appointments. And also one of our quality measures was well-controlled diabetes for our patient population. And we had, and our
Meaningful
scores,
use, right?
yes, the meaningful use, yes.
Yes.
And so our numbers weren't doing really good at the time. And so, I wanted to create something that would not only help patients get through the door, but also would help with their health outcomes. because they're sort of interchanged, you know, in looking through the literature when I did this study, it was just profound, all of the, you know, the associations that were made between coming to the appointments and health outcomes. So it was a lot of that reoccurring theme that I noticed. And so it was definitely something that I wanted to bridge in deciding to take on this challenge of missed appointments and diabetes health outcomes, because it's something that really hits home. And to service populations that are predominantly Latino and African American, which are two of the highest populations impacted by diabetes, it sort of increased the level of urgency to really find something that was effective in getting patients in the door, but also impacting those health outcomes in a positive way.
Well, I want to thank you for taking time with us, Dr. Rodriguez.
Outstanding, outstanding.
Now,
Yes, thank you for
are
having me.
somebody who is changing practice. You really are.
Yes,
You
thank you so
are.
much.
Keep
That's
doing
we're-
what you're doing, and I hope that this model can maybe be replicated for different disorders or medical problems like asthma or weight loss or smoking cessation, or I think this could really be congestive heart failure. I think this could really be something that could be done even further. And I wish you luck in all of that. I hope that you continue to research what you're doing, but even using it further in your practice. And you're being a model. You're a tremendous model for all of us to do these things.
Thank you so much. Thank you so much. I appreciate that.
No problem. Thank you for being with us. And thank you all for listening to NP's Changing Practice. And join us again for some more tips and tricks. We will see you next week.